This is Melissa Ainsworth presenting Medscape Application. Medscape's mobile application is a valuable all-in-one resource created specifically for healthcare professionals. The application is free of charge to anyone with use of an iPhone or Android operating system. The purpose of this application is to provide clinical tools, education, and resources to help healthcare professionals maintain current practice standards and continuing education credits. The application is made by healthcare professionals and its content is accredited. Its contents include multiple tools including drug database, calculator, disease processes, and more. Medscape offers a valuable tool for nurses to utilize as a reference in the clinical setting. It offers the convenience of having multiple resources in one easy-to-use application. Whether a novice nurse or experienced nurse, Medscape has what you need to have the knowledge and confidence to provide quality bedside care. Multiple tools can be accessed to look up unknown medications, disease processes, procedures, clinical guidelines, and features a calculator. The information can be used for patient education as well. Application features like decision points and latest guidelines include information including management treatment options and complications to help nurses guide care. The Prevention tab in Decision Points offers education material for teaching patients about disease prevention and health risk. The latest guideline feature is useful to nurses to keep up with the changes as new research is always prevailing and guidelines are updated to reflect best practice of care. The usability of the application is easy to navigate and use. You must first register an account by providing an email address and making a password, as you see on the right side of the screen. During this process, you choose a professional title and specialty to customize the application to your profession. Once an account is made, which only takes a few minutes, you will see the home screen, which is located on the left of the slide. A query search is available, or the touch icons may be used depending on the desired information you wish to explore. From the home page, each touch icon opens the category windows, as seen here. Most categories contain a query search option to increase the speed of finding desired information. Also, the query search option on the home screen can be used for fast results. This function makes workflow effortlessly and aids in finding desired information quickly. The results are in standardized medical terminology that healthcare professionals can easily understand. Since the site is fully credible, healthcare professionals can rely on accurate information as an adjunct to their profession. Medscape is an application used as a reference resource. Therefore, there are no legal, ethical, or security issues associated with its use. Users are to assume clinical judgment when using information contained within the application. Analyzing Medscape's application, the pros drastically outweigh the cons. Medscape's free all-in-one resource for healthcare providers clearly is a valuable resource to all. I would recommend this application because it is easy to use features, abundant amount of scholarly resources, is economic, contains education material to earn CEUs, and can be used without Wi-Fi. The only con is that with its vast amount of information available, finding the information desired may take time, which is valuable in the clinical setting. In conclusion, Medscape's application is a useful and recommended tool nurses can use to access information needed in the daily clinical setting, as well as self-education to stay current on guideline practices and new research. The application is an all-in-one free resource. The education material is applicable to nursing to use for a medication guide, disease process and treatment options, risk modification education for patients, calculator, and so much more. I highly recommend downloading this valuable application today. Thank you for your time and attention.